Good afternoon, everyone, and welcome to the Missouri Board of Pharmacy webinar today. I'm Tom Glinski, Chief Inspector, and with me today is our Executive Director, Kimberly Grinston. Before we get started, I'm going to go over some general information if you haven't been on our webinars before. All participants are in listen-only mode. If you have any trouble with audio connecting via the computer, you can use a telephone to call in. There's dial-in information on your GoToWebinar toolbar there if you need to do that. This has been approved for 1 hour of Pharmacy CE. You must be logged in yourself to GoToWebinar. You cannot be sharing a computer to get credit. I'll go over instructions for CE and at the end of the webinar. And just a reminder, our CE is not submitted to the CPE monitor, so you need to save your certificates. Handouts are posted in two places. You can go to our board website under the upcoming events, and there's a link to handouts under the webinar posting there. And also on the GoToWebinar toolbar, down towards the bottom, there's a handout section, and you can click there and get a PDF of today's handouts. We do record all our webinars, so there will be a recording of this one. Usually takes 1 to 2 weeks before they're posted, but you can find all our webinars on our website. We plan to have time at the end to take questions from participants. If you'd like to send a question during the webinar to us, go to your webinar, type that toolbar, type it in and hit send, and at the end we will try to answer some of the questions that come in. Today's webinar, we have it broken down into the statutory changes that came out of this year's legislative session. We're going to have a COVID, some 19 updates, regulation updates, and then some resources updates and a discussion on pharmacist well-being. And as I said, we'll try to answer questions at the end. So now I'm going to turn it over to Kim.
Thank you, Tom, and thank you, everyone. Again, this is Kimberly Grinston, Executive Director for the Missouri Board of Pharmacy. And thank you, everyone, as always, for joining us on this webinar. It's always a good chance for us to share what's happening at the board office, also what may be happening that may impact you as licensees and registrants of the board. I want to encourage everyone once again to please enter any questions you may have into the chat feature. I think we will have some time to answer a few questions at the end of the webinar and would be glad to do that. So if you answer your questions, we'll try to do those at the end and not as the presentation is ongoing. Let's begin with 2021 statutory changes. And this year was a relatively light year for pharmacy. In previous years, we've had multiple pieces of legislation passed. This year, we primarily had two main provisions or two main bills that impact pharmacy practice probably most directly. I do need to give a caveat. I am not going to give you a full summary of everything that passed this year and/or all requirements. I'm just going to give you a very bird's eye view of some of the legislation that was enacted in 2021 that may impact your practice or be of interest to you. So we'll start with Senate Bill 63. The two major bills that I want to talk about are Senate Bill 63 and House Bill 273. Senate Bill 63, one of the things that it did was it extended the current RX Cares for Missouri program. For those of you who may not know, the board has statutory authority that has now been extended to operate the RX Cares for Missouri program, which is focused on promoting medication safety. Funding from the program has been used to support partially the RX Cares Medication Destruction Program, which is the statewide medication destruction program that the board has implemented in conjunction with Sharps, the board-approved vendor. As part of the program, licensees can still you can still register to participate, and as part of the program, we do provide free drug receptacles, take-back receptacles that are DEA and BDD compliant, also liners, and also pay for disposal of medication up to 12 times per year. Applications for the RX Cares for Missouri program are available on the board's website. If you go to applications or forms or publications and resources, you will see applications there. We are still accepting applications if you are interested. Senate Bill 63 also enacted the prescription drug monitoring program. Many of you have already heard that Missouri is no longer the only state in the nation that doesn't have a statutorily implemented PDMP. So the language has been passed. Currently, the PDMP is under the jurisdiction of the Missouri Office of Administration. And that is, for those who are not familiar, it is the general administrative office for the state of Missouri. They handle purchasing and just a variety of things for the state agencies. As part of the legislation, the Joint Oversight Task Force has been created, which really will be responsible for implementing and establishing rules for operation of the program. Under the statute, you see the required members for the task force there on the screen: 2 pharmacy board members, 2 healing arts members who are MDs, 1 nursing member who's a PRN, and then 1 dental board member who has to be a dentist as well. So that's the makeup of the task force. The PDMP is not under the jurisdiction of the Board of Pharmacy or the Department of Health. Again, the Missouri Office of Administration and the Joint Oversight Task Force will be tasked with establishing and implementing the PDMP in Missouri. So the statute specifically provides that OA can contract with a vendor to operate the program. And so this will need to go out for a competitive bid if a vendor is awarded. Under the statute, real-time patient data must be reported beginning January 1st, 2023. So we have some time on implementation deadlines right now. By January 1st, 2024, all data must be reported in real time, and dispensing data, that is. We've gotten calls in the board office from licensees asking what they need to do to be in compliance with Missouri's PDMP. Once again, the PDMP is not currently operational. OA and the Joint Task Force will need to go through the bidding and also rulemaking process. I encourage everyone, we'll have updates and notifications and e-alerts that we will send out from the board office to let you know when there are meetings that may be of interest to licensees and registrants. So please, if you aren't signed up for the board's newsletter and e-alerts, please go on our website and do that to make sure you have updated information. The PDMP is available to healthcare providers, but they are not required or mandated to review the PDMP. And I know that was a bit controversial during the passing of the legislation, but currently healthcare providers have access, but they are not mandated to check the PDMP before prescribing. Local PDMPs, so all of those who are participating in a local PDMP, the statute says that all of those programs will terminate once the new program is operational. Again, we have some time yet before that is in effect, so all of the local PDMPs that are operational are still in effect and are unaffected until the statewide PDMP is up and running. Now let's talk about House Bill 273, which is our other major bill that will impact pharmacy practice. It is a bill that authorizes pharmacists to dispense HIV post-exposure prophylaxis medication, or HIV PEP, under protocol with a licensed physician. The bill amended Section 338.010, which includes the definition of the practice of pharmacy, and also enacts a new statute, 338.730. Both of those statutes, if you go to the board's website and click on statutes and rules, those statutes are currently available if anybody would like to read the actual language. They are currently available, but they don't become effective until August 28th of 2021. Once again, pharmacists can dispense HIV PEP medication under protocol with a licensed physician. When the bill was originally filed, it did include PrEP as well. And I understand that during the legislative process, there was quite a bit of discussion about authorizing pharmacists to dispense PrEP. The final legislation only includes PEP at this time under protocol. Of course, pharmacists must comply with CDC guidelines. And the statute also provides that the Board of Pharmacy with the Board of Healing Arts must file joint rules to implement the new provisions. Many of you may be familiar with this process. So the board is currently required to promulgate joint rules for flu vaccines and also medication therapy services. We have to jointly file a rule with the Board of Healing Arts to officially authorize HIV PEP dispensing by protocol. Pharmacists cannot dispense by protocol until the joint rules are promulgated, although the actual statutory legislation will be effective on August 28th. The board has already started the process, and I'll go back for just a moment, of looking at a rule. The board met on yesterday and looked at a preliminary version of the rule. The board will be meeting again in October 19th and 20th. If anyone is interested, that meeting will be webcasted virtually, and you can join. Public information will be available on the board's website. I anticipate that the board will once again look at draft rules in October. After that time, if they are approved October, November, we then send it to the Board of Healing Arts for review and approval as well. We're hoping that this process moves quickly. We always like, when there's new legislation, to make sure we are moving that along as quickly as we can, but we do have to go through both regulatory boards and then, of course, go through the joint rulemaking process, which can take an additional 6 to 9 months. So I don't know when those rules will be effective, but the board has begun working on them, and hopefully we will have something at least filed within the next 6 to 8 months. COVID-19 updates. So that's a summary of new legislation that passed. Again, that's not everything that passed, but just the major pieces that may impact you from the regulatory level. Now let's talk about some COVID-19 updates before we get to regulatory updates. Right now at this time, and I have to advise everyone that this information is current as of before the webinar. This information can change during the webinar, but right now, the state of emergency is scheduled to expire on August 31st of this year. That means that all COVID-19 waivers will expire when the state of emergency expires. The board is monitoring developments here on this. So we understand that there have been some discussions with the governor's office about extending the waivers and possibly the state of emergency. We are waiting for that official announcement from the governor's office if that will happen. Once that is done, if we do have an extension of the state of emergency or the extension of the COVID-19 waivers, once that is done, we will post a revised waiver document, a revised guidance statement on the board's website, and we'll also send out an e-alert. So please, once again, if you're not signed up for the board's e-alerts and newsletters, please do so, because we will be pushing that information out through those mediums. Other COVID-19 updates, HHS has once again amended or issued their 8th amendment of their emergency declaration. So we've had two things happening. First, I want to note that the FDA recently amended their emergency use authorizations for the Pfizer and Moderna vaccine to allow an additional dose of COVID-19 vaccine for designated patients. Many of you have heard of that already and have already actually contacted the office. Under the COVID-19 waiver, the state COVID-19 waiver, pharmacists are authorized, to administer COVID-19 vaccines that the FDA has approved or issued an EUA on. Because that authorization applies to FDA's allowances broadly, no additional changes need to be made to the COVID-19 waiver. The COVID-19 waiver currently allows you to administer the additional dose in compliance with FDA requirements. And that means that you can immunize under HHS's authority directly with nothing more. Of course, you would have to meet all training and documentation requirements required by HHS. By protocol with a Missouri licensed physician, this is listed in the COVID-19 waiver, the state's COVID-19 waiver, or under the Missouri Department of Health standing order. Again, the board sent out an e-alert on this, I believe 2 days ago. The Missouri Department of Health has revised their standing orders. They were revised on August 18th to include the additional COVID-19 dose. So if you are administering under the standing order, the Department of Health's orders now include that. You may need to amend your protocol, because if your protocol is restricted only to the initial doses of Pfizer and/or the Moderna vaccine, you may need to amend your physician protocol if you're administering under the protocol. The restriction is not in the COVID-19 waiver, but I would check if you are, again, administering vaccines under protocol to make sure you don't have any restrictions in that governing document. HHS's 8th emergency declaration clarifies and extends immunization authority to pharmacists, qualified pharmacy technicians, and intern pharmacists. It allows them to administer pediatric vaccines to children ages 3 through 18, COVID-19 vaccines to children from ages 3 and up. And also, the most recent emergency declaration extended authority for qualified pharmacy technicians and intern pharmacists to administer flu vaccines to adult ages 19 and above. Previously, techs and intern pharmacists could administer a flu vaccine under the pediatric vaccine allowance, but that only applied once again to ages 3 through 18. The 8th emergency declaration now extends that to 19 plus. And I want to stress again that immunizing technicians and intern pharmacists must meet all requirements in HHS's guidance documents and emergency declaration. If you go to the board's website and in our current guidance statement, we have a current guidance statement that compiles all board guidance on COVID-19 issues. I think everything that the board has issued since the beginning of the pandemic, and all those documents have been updated. If you go to that document, there is an HHS training chart that will show you what HHS's training requirements are for techs and intern pharmacists. So if you're interested, that document is very helpful because the emergency declaration can be a bit of a maze, and HHS gives a lot of clarification in that document. A few other COVID-19 updates as we move along. The board has received questions about pharmacies receiving prescriptions for ivermectin. And we have been asked if the board has issued a statement on ivermectin prescriptions for the treatment and/or diagnosis of COVID-19, of course. The board has no position at this time. However, the FDA has issued an advisory about ivermectin dispensing to treat or diagnose COVID-19, and they have clarified and affirmed that ivermectin has not been approved for the treatment and/or prevention, of COVID-19 at all at this time. So there is no board position, and we would remind licensees that you all always have the discretion, pharmacists, to decline to fill a prescription if you don't believe it is issued for a legitimate medical purpose. That is the discretion that is vested in all pharmacists, and so we would remind you of that should you decide not to dispense ivermectin. Couple of other updates, non-resident pharmacists, we do have the COVID-19 waiver still in place. Again, this is dependent on the extension of the state of emergency that allows non-resident pharmacists to administer COVID-19 vaccines in Missouri without a Missouri license. While the state of emergency is in effect, that allowance is still there. The board is requesting that you file an emergency practice notification form on the board's website. It's not an application. There is no fee attached to it, but it allows the board to know who is practicing in the state. So if you are using non-resident pharmacists to assist you with vaccines, we are asking that they complete the emergency practice notification form. So once again, we know who is out practicing in Missouri. The board has received questions about technicians at drive-through clinics who may be assisting with vaccines. The specific question we've received is whether a technician and/or an intern pharmacist can administer a vaccine from the parking lot while the pharmacist may be inside a pharmacy. So we've been asked specifically about drive-through clinics. Again, technician is outside administering vaccines and the pharmacist is inside the pharmacy, but available to the technician. I think in the instance that we specifically reviewed, cameras were being used to monitor the pharmacy technician's activity. I want you to know that currently the board's rule says that pharmacy technicians, when immunizing, must be under the supervision of a pharmacist who is physically present on site. So under the board's rules, a pharmacist should be physically present when the technician is administering or given a vaccine. Finally, emergency planning. We are still getting questions about closures. Unfortunately, as COVID-19 numbers continue to increase and go the way we probably weren't anticipating or don't want them to. We are hearing about pharmacies once again having some staffing issues. Want to remind pharmacies, if you look at the board's guidance, the board has issued guidance for pharmacies that may need to close quickly because of staffing issues or COVID-19. We are recommending that you provide patients as much notice as possible, posting something on the door or on your website or on your voicemail. Sometimes we get calls from patients who don't know where to go. It would be great if you could leave just a message there. Make sure you give them instructions on how to contact a pharmacist or speak with the pharmacy, even if you have to close. And please notify the board if you will be closing. We have had people who have just called us to let us know we're going to be closed for the next couple of days, next week, or whatever it may be. It just helps us because when we get those patient calls, we can then let patients know that there was an unanticipated closure to the extent that you may not have time to do so. That is a request. It is not mandatory, but it will help us as we answer calls here in the board's office. Again, we'll be taking questions on this at the end of the webinar, but I want to move along as we move into our regulation update. So in addition to all the statutory changes and in addition to all the COVID-19 updates, we now have a few regulation updates for you on things that have recently been amended. This is just a list of recent changes, and we're going to walk through, Tom and I, some of these in just a moment. The first one I want to make you mindful of is 2.42425, which went into effect, I believe, July 30th. So this is a brand new rule. The title of the rule is Required Pharmacy Reporting. As many of you may know, under federal law, the FDA has authority to enter a compounding MOU with the relevant states that is related to compounded preparations that are shipped interstate, human compounded preparations that are shipped interstate. Under the federal law, for states that do not sign the MOU, if they do not sign the MOU, pharmacies in those states would be limited to shipping no more than 5% of their annual compounded preparations interstate, and there is a mandatory 5% cap. And we've had several discussions about this on previous calls and also previous board meetings. The FDA released their final MOU, I believe, in 2020, with a signature date that was originally scheduled for October 27th of October of 2021. The rule was intended to implement reporting to allow the state to comply with FDA's compounding MOU. Missouri has not signed the MOU as of right now. However, the board and the governor's office has approved signing the MOU. We were waiting for the rule to go in effect. Under the rule, it allows optional reporting to NABP's national database. NABP will be doing a national reporting option. And again, this is reporting of compounding data from Missouri pharmacies. I want to note that the rule applies to all pharmacies that have distributed or dispensed human compounded preparations during the previous calendar year, interstate or intrastate. So in Missouri or outside of Missouri, and that includes all pharmacies and not just Class D and Class H. So if you're unaware of the rule, I would suggest that you take a look at it because it would apply to all pharmacies that are compounding human preparations. FDA recently announced that the enforcement date has been delayed until October 27th of 2022. However, the rule is still effective. We anticipate that the board will issue additional guidance after the upcoming October meeting on pharmacies complying for the 2021 calendar year. But at this time, again, I think licensees who are compounding human preps, that you all should go in and take a look at the rules so that you know what the rule will require once the MOU is signed. The board is meeting October 19th through 20th, and so if anyone has an interest in this topic and or any other topic that is before the board, please mark your calendars. October 19th through 20th, the board will be meeting virtually. Another rule change is 2.685, and this is a rule that establishes a new class of pharmacy, a Class Q charitable pharmacy. As you all know, we have several classes of pharmacies in Missouri. Last year, Senator Sater sponsored legislation that created a new Class Q charitable pharmacy. And the rule defines a Class Q charitable pharmacy as a site that is located in Missouri, so this does not apply to non-resident pharmacies, that are owned or operated by a charitable organization and provides pharmacy services to a qualified indigent patient. That term qualified indigent patient is defined, you'll see this on the screen, as a patient that has been screened and approved and deemed not to have sufficient funds to obtain needed medication based on pre-established criteria. So this is really meant to relate to those pharmacies that are truly operating charitable services. Class Q charitable pharmacies may only provide services to or for qualified indigent patients. So you can't be a Class A and a Class Q. A Class Q can only provide services to qualified indigent patients. If you're providing services outside of that class, then a Class Q would not apply to you. There are several allowances for Class Q charitable pharmacies, the main one being that the rule authorizes Class Q pharmacies to dispense medication when a pharmacist is not present, provided either that the pharmacist has already verified the medication or the medication is going to a healthcare provider for administration on site, and barcode technology is used to verify that the correct product prescription medication has been dispensed. So think about a clinic in that setting. Let's say you have a charitable operation, you have a charitable pharmacy on site, you're going to be giving medication to a nurse or physician who's providing services, and barcode technology is used to verify the medication. That is authorized in a Class Q charitable pharmacy. Also, Class Q pharmacies can accept and dispense donated medication received from a variety of entities and or other healthcare providers. Donated medication, however, cannot be accepted from a patient or the public. So we're talking about donations in between licensed and or regulated entities for the most part. Once again, donated medication cannot be accepted from a patient or the public for redispensing. Class Q charitable pharmacies, I want to reiterate, can only provide services to qualified indigent patients and cannot service other populations. So that's a general description of the Class Q pharmacy rule. Anyone who has additional questions or want to know, if you want to know more about the requirements, please see the rule. I'm going to turn it over to Tom, who's going to talk to you now about sterile compounding.
Before I do that, if an entity is interested in a Class Q, I would highly recommend you get maybe with your local or inspector and me. We've actually done this already once with an entity, and we'll sit down with you and go through the rule and make sure you understand it, because there is some unique twist to this rule that we don't see at other pharmacies, and we're more than happy to walk you through it to make sure you fully understand those. So we did have a change to the sterile compounding rule. It was done by emergency rule that's in place now, and it will become final in October. It affects risk level 3 compounding, and that's non-sterile to sterile compounding. And it basically deals with a process in where a pharmacy is using stock solutions that are risk level 3. They made them from a non-sterile ingredient, and then they use those stock solutions to make further preparations. This is probably one of the shortest rule revisions we've done. It just deletes one sentence out of a rule, and basically what it's saying is once you've tested it and you determine it to be sterile, you can go ahead and further use that in preparations without having to further test it, those preparations downstream. So this is a very limited, basically the few risk level 3 pharmacies we have in Missouri and out of state. It affects those. The next rule that had a change, a revision to it, was the transfer rule. So this is for both new and refill prescriptions. It was revised back in May, and again, another short revision. I have here what the rule did say, and it said that all transfers had to be done within 1 business day of receiving the request. And that sentence has now been broken down into 2 parts. And the first part deals with a request coming directly from a patient or their caregiver. And if you get one from those, then the 1 day still applies to you. All other requests, and this would include requests from pharmacies to pharmacy, now falls under this new requirement of getting it done in a timely manner so that there's no interruption in therapy. So the one-day business requirement does not apply. However, it shouldn't lead to a patient running out of medicine. So we get questions, well, how do we, if we have that situation, what do we need to do? If you're the pharmacy that is requesting it from another, you need to explain when you make the request, if it's time sensitive, you need to express that to them, and that way they know that it is a matter of time to get that. But the standard one day will not apply anymore. It gives pharmacies, we've had issues with pharmacies questioning where requests were coming from, third parties were involved, and whether patients actually requested them. And this way, if pharmacies wanted to contact those patients to confirm that before giving it, it gives them a little more time to do that now. But again, if the request is coming directly from the patient or their caregiver, the one business day does apply. And then BNDD made a change to one of their rules. This took effect in April. It was the partial filling rule. It actually increased the time that a Part C2 can be partial filled from 30 to 60 days. When they originally wrote the rule, which went in effect last year, it actually didn't match what DEA said when it came to long-term care and terminally ill patient prescriptions, which DEA would allow them for be 60 days. However, BNDD's rule back then was more restrictive at 30 days. So now it is increased it to 60 days, and so it'll match with the DEA's. I do want to caution you that DEA does have a 30-day limit for any partial fill request that comes from the patient or prescriber. So even though BNDD says you can go 60 days, DEA would still limit you to 30 days from the date it was issued to partial fill if it was requested by the patient or the prescriber. Here's a couple of rules. The board has approved these and they're in the process of becoming finalized. The first one has to do with the disaster rule. This is a complete revision and it's all the way through the process. And we have an effective date of October. The big change here is the old rule was limited just to declared disaster areas. So the governor had to declare a disaster in a county or an area before that rule took effect. This new rule will encompass what I would call single type of emergencies, where a pharmacy is affected by a fire, a flood, a tornado, or something that puts them out of operation at their location. It now will allow them the same opportunities of what used to happen in a declared disaster area, of being able to move more freely to a new location and get set up and continue operation. So again, this will take effect in October. And then the board just recently approved a revision to the Class J shared services rule. It's just in the starting process, so we don't have any dates yet on when it might be. It hadn't even gone through the public comment period yet. And basically it is going to ease up on the requirement for what kind of shared records you have between the two pharmacies. It'll be a little more lenient, should allow pharmacies who aren't under the same ownership greater flexibility in complying with the rule. And then the other thing it does, it specifically says that a new prescription transfer under the long-term care exemption in the transfer rule is not considered Class J. This was for initial fills that a long-term care pharmacy may need to get an initial part of that filled at a local pharmacy. And they may have an agreement set up to do that. And we specifically now say in rule that this is not Class J. And then just some other things, Kim talked about some of these already. These are things that the board is talking about, reviewing some revisions to, and as Kim said, October will be a meeting where probably the majority of these will get discussed again. but major revisions to the standard of operations and the pharmacist in charge rule. And as Kim said, the HIV post-exposure prophylaxis rule. And then the board is looking at a new rule to allow certain kind of technology-assisted product verification. So if you have an interest in any of those, the October board meeting, as Kim said, will be online if you'd like to listen in to those discussions. Just quickly, I'll tell you about a few resources we've updated in July. 4 things were revised. The practice guide, and that's now posted on our internet, and we are in the process of mailing it out. I don't know.
They've been out this week.
They've been mailed this week to all the pharmacies in Missouri. We'll get a paper copy of it again. And then the practice guide that goes with that, the CE quiz that goes with the practice guide, so you can now get CE for reviewing the practice guide, that was updated. The pharmacy self-assessment guide, that is basically a self-inspection document that you can inspect your own pharmacy, picks, and owners can get CE for doing that. That has been updated. And then the pharmacy technician guide was recently updated. So all these are found on the board's website under the news, publication, and resources link on the left side of the website. Yeah, Kim wanted to talk about pharmacist well-being.
Thank you. And again, please monitor the board's website. Also look at our current rules if you'd like additional information. I would encourage everyone as we get ready to switch to our Q&A portion to please put any questions you may have in the chat box now. Tom is looking at questions at this time. Looks like we will have quite a bit of time to answer some questions from you. So if you have a question, to the extent we can answer, go ahead and add your question into the chat box. I do want to make a note because, as you all know, the board is looking at pharmacy staffing and pharmacy working conditions. The board has received several complaints, questions, concerns, comments about current conditions. And this is not something that's just unique to Missouri. This is something that has been happening nationwide. Although COVID-19 may have raised this issue, I think this is an ongoing issue for healthcare altogether. And one of the things that I wanted to mention, and that we've also included in the June newsletter, is to talk about pharmacist well-being. And I put pharmacists, but technically this applies to everyone, our intern pharmacists, our licensees, our technicians, anyone who is supporting the pharmacy. We understand that demands are very high right now. As we get ready to roll out boosters, or the nation does booster shots for the COVID-19 vaccine, and as numbers go up, vaccines and testing will likely go up as well. This is a busy time in pharmacy. Pharmacies are busy anyway. This is a busy time in pharmacy. The Board of Pharmacy is looking at what they can do to make sure patients are protected in our daily pharmacy operations. But as we look at what the entities can do, and a lot of times we worry about the entity, but we'd also like you to focus on you as individual practitioners. Again, this is a stressful time, and a stressful time stress can affect and impact people different ways. Maybe if not you, people who are working with you, and you probably need to know and be able to recognize some of the signs that someone may need additional help. In a June newsletter, we posted a bit of information about this, including information from the Mayo Clinic to help to determine if you possibly may need to talk with someone about your well-being. I believe everyone is responsible for taking care of themselves. We want to make sure that our licensees and registrants are taking care of themselves in this busy time. There are a lot of things that we cannot control at the board level, at the staffing level, at the pharmacy level. There may be things you can't control, but when it comes to you and your personal health, we want to encourage you to please seek help if you need to. We have several resources in the June newsletter. The National Suicide Prevention Lifeline number, you'll see that on the screen. The National Helpline is a national toll-free line that you can call just to talk with someone if you need additional assistance, and they can help provide you resources. The crisis text line, if you are not a caller and you prefer to text, we also have a statewide crisis text line. Just text most safe to 741-741. Again, text most safe to 741-741, and someone will reach out to you. I believe that's operated by the Department of Mental Health. Grad resources, so there is a special resource helpline just for students, not necessarily graduates, but just students altogether. So our intern pharmacists that may be on the webinar, that number is listed there. And all of these resources, at least the initial calls, are free, and they will help place you or direct you to where you can get additional information. There is a deaf crisis line, that is a TTY line. That information is on the screen. And finally, and probably most important for me, the Veterans Crisis Line. For all of our veterans, there is a specific crisis line that is operated just for all of those brave men and women who have served our country. If you know someone, it may not be you, it could be a family member, it could be someone in the pharmacy, or perhaps even a patient that may need one of these resources. We're going to ask that you pass it along and also use it if you need to. I also wanted to let you know there's a video that it's called Who Saves Me? And I think it's just a very good video for healthcare professionals that talks about what we know you're going through here in the middle of COVID-19. That link is here and also in the June's newsletter, which is on the board's website. If you'd like additional information on mental health resources or just well-being resources, sometimes the term mental health, people respond to that differently, but well-being, if that's the term that works best for you, making sure that you are well, the Missouri Department of Mental Health has additional resources on their website. We can't keep patients safe if we're not taking care of ourselves. So make sure, again, that you're talking to people in your pharmacy, talking to those loved ones that you know, employees, co-employees, and making sure that they are also okay and also are aware of what may be available for them. All righty, thank you. And now we'll go on to Q&A, and Tom's been going through the question.
Okay, so if you'd like to send us a question, go to your toolbar, you type it in and hit send. So we have someone asking, could you tell again how to print the slides? So they're in two spots. If you go to the board's website, on the home page on the left side is a link called Upcoming Events. If you click that, you'll see two webinars listed there. Under webinar 1 is a link to the handouts, and you can print it there. Or on your go to webinar toolbar, down towards the bottom is there's a handouts, and if you click that, you should see today's handout where you can download it right off the webinar toolbar. Okay, so we have someone asking what's going to happen with the PDMP in St. Louis. As Tim said, once the statewide one is up and operational, any local ones have to shut down. However, it's my understanding that the statute includes a provision that the statewide can get data from them if they can work out something, if that's allowed with the local ones. So it is possible that the state might be able to get the data that St. Louis already has in theirs and incorporate it into theirs, but it's too soon right now to tell you that's going to happen or not. But I'm sure that the task force is going to that's one of the things the task force will need to tackle once it gets up and running.
Someone is asking if they need to worry about the MOU if they do not dispense 5% or more of their compounds to other states. So the MOU is applicable to the states themselves. However, the reporting requirement that would be in the rule, or that is in the rule, applies to all pharmacies that are compounding in the state. So the answer is yes, there may be some reporting, there will be reporting requirements for you, although you may not need to report the expanded data that may be applicable to pharmacies that are dispensing interstate. So yes, the rule does apply to you, the reporting does apply to you, but it may not be as extensive for you since you are distributing or dispensing a limited amount. Someone has asked, has the Sterile Compounding Pharmacy Self-Evaluation Guide been developed yet? It has not. We are working on it. Hasn't fallen off of our radar. I think COVID-19, just all of the other developments with that may have sidetracked us, but thank you for keeping it on our radar, and we'll make sure that we take a look at that and let you know when there are any changes. Someone has asked us the state board monitor provision of lunch breaks, and this is related to pharmacist well-being. I think it's an excellent question. So generally, and I think this is a place where we can provide a lot of clarification, the board, Department of Labor generally handles, governs, regulates workforce conditions and things like rest breaks and lunch breaks. So some of that is determined at the federal and state labor levels. What the board does have, and so the board doesn't have jurisdiction over some of those things to a certain extent. What the board does have jurisdiction over is how pharmacies are operated. And as many of you heard, several states have considered and or implemented provisions that require mandatory lunch breaks. That is not currently in effect in the state of Missouri, although the board has formed is forming a working conditions task force, and that is going to be one of the things that I am sure they are going to talk about. Of course, the difficulty with that conversation is what is appropriate for every practice setting, since we have so many. And that conversation, we want to make sure that we have a diverse amount of people at the table to really get the perspective of all of our practice settings and also all of our areas, the rural areas, our independents, our larger chains, before making that decision. We are encouraging, and we said this in the statement that the board issued, I believe, a few months ago. The repetitive nature of just moving through the pharmacy, as well as the clinical skills that a pharmacist is required to use, you need time to take a break. There needs to be a refreshing to make sure that you can continue to operate at the level that makes a patient or keeps patients safe. And so we remind all of our owners to take a look at that. Our inspectors are currently, many of you may have had visits from our inspectors asking and inquiring about that during inspection and also during our investigations. So this is something that the board will be looking at going forward.
Okay, so we'll stay on the compounding. We have a bunch of compounding MOU things. Somebody want to know what does MOU stand for, which I guess we probably should tell you. It's Memorandum of Understanding is what it stands for. It's really not a pharmacy term at all. And that's just the title of the document that FDA created for the states to sign. We have someone wanting to know, does simple compounding like first kits, magic mouthwash must be reported? And the answer will be yes. When we initiate that rule and when we tell you have to report, it will include any human compounding. It's not designated on how complex it is. So yes, and when the reporting is just numbers, it'll be number of prescriptions dispensed, compounded prescriptions dispensed or distributed. You're not actually giving us specific information about the compounds. I believe it's strictly just how many did you do in the last year. We want to clarify, our nuclear radiopharmaceuticals excluded from the reporting. I believe so, but we'll have to double check that. We also someone asked, is sterile compounding have to be reported? The answer is yes. We have someone asking, well, what about compounds within the hospital that are made and used within the hospital? My understanding, they are not.
They are not. We only have jurisdiction over pharmacies that are licensed and regulated by the board. Compounds that are distributed or dispensed under a hospital's license or under the Department of Health's jurisdiction would not be subject to Missouri's reporting requirements.
We have a COVID question. They want to clarify what the third dose booster is, what can be given at this time. It is immunocompromised. It is not just any health condition currently. If you have questions about that, you can look at the standing orders. They were revised in Missouri. You could look at HHS's guidance that have been issued.
And links to those are on the board's website under the board's COVID-19 page.
Someone's asking, are all the phone numbers and stuff you gave out, are they free of charge?
Yes, for the initial calls, they are free of charge. Now, I do understand, of course, if they refer you to a treating provider, that may not be, but everything that I showed you, those calls are free of charge.
We got some controlled substance questions here. They said kind of off topic, but does the narcotic limits apply to animals? I assume they're asking, if you're talking about the 7-day opioid one, that does not apply to veterinary prescriptions, and the PDMP excludes veterinarians also. So I'm not quite sure what you're asking there, but those two laws do exclude.
I'm going to go back to the MOU really quickly. Someone is asking if the MOU includes both 503A and 503B. The MOU relates to 503A information. Someone is asking if Missouri plans to amend their statutes to allow tech administration of vaccines. We already have. If you look at 6.050, the board amended this last year. I think it was a very strong and proactive move by the board to allow pharmacy technicians to administer vaccines, of course, under the supervision of a pharmacist. That includes by protocol and also by prescription order under the supervision of a Missouri licensed pharmacist who qualifies to provide vaccines and administer medications. So that has already been done. Additional training requirements apply. And if you look at the practice guide, it's listed there as well.
We got another vaccine. Has the board ever discussed allowing pharmacists to do it without a protocol? And the answer is, yeah, they actually have. It's actually, but it's a statute, so it would require legislation to do that. And typically something that the board might not be the ones that would be doing that. It might be the association. So you might pass that on to the association as a possible thing they might want to look into. But yes, the board has had discussions about that, but right now our hands are tied by a statute on that. Someone wants to know, how do you report the compounding information? That's going to come later when
it is, and we'll give you some more information on that in October. So the rule currently allows 2 reporting options. You can report the information to the Board of Pharmacy directly, or you can go through NABP. NABP has, because all states are dealing with this now as well, NABP has established a national database that will allow you to electronically report required compounding data. The board didn't add any additional requirements outside of what the federal, or reporting requirements outside of what we understand is in the MOU. So reporting to NABP will meet compliance with the rule. I am actually demoing NABP's system right after this webinar. After October, we'll provide additional information on what needs to be reported and how it needs to be reported, and may actually include that on an upcoming webinar. So stay tuned for now.
Someone's asking about technician administration. Is it just vaccines? Under the protocol, it's just vaccine, but we did also modify the by prescription order rule, that's 6.040, to allow a technician to also give any other drug that a pharmacist would be able to administer. That the same requirements in the protocol rule are also in the prescription order rule.
Someone's asking about the MOU again. The FDA MOU. Isn't the MOU for interstate prescriptions only? So the MOU is intended to gather data about what is going interstate. However, the reporting requirement applies to compounded preparations within the state as a whole. And so that includes in-state and out-of-state. Now, there are extended reporting requirements for pharmacies that are shipping interstate and meet a required threshold. But for all pharmacies who are compounding, you are subject to the rule, and the reporting would apply. And I think that's one of the things that we really are going to work hard on, making sure we educate licensees on, is that while the MOU does have additional requirements for interstate shipments, all pharmacies compounding will be required to comply with the reporting requirements of the rule.
A couple questions here on partial filling. So someone wants to know, does the partial filling apply to any retail pharmacy patient? And they want to know, is it 60 days? If the patient requests it, it does apply to any C2 prescription. If the patient requests it, or the prescriber, then DEA limits it to 30 days from the date it was issued. If you're partial filling it because it's a long-term care patient or a terminally ill patient, then 60 days applies. But if it's just strictly a patient request, then it's 30 days. And then someone wants to know about the 72-hour limit when you don't have something in stock. That is still on the books with DEA, that they still have that. It hasn't been on that. So it does still apply. I think you would need to ask DEA on how the new partial filling, if the patient requests it, fits into that. To me, that if you told the patient they don't have it all, and they say, well, then partial fill it, then it kind of became a patient request, and maybe the 30 days would apply to that. But again, that's not our rule, so I cannot give you guidance on that.
Someone has asked once again about the working conditions document, and they are noting that PICS, a lot of the pharmacists in charge, you all don't have ability to increase staff to meet patient needs, and they are asking, as hours are being cut, things are becoming dangerous in the pharmacies, what can you do, or how can you contribute to the board and the task force? And so I want you to know, first of all, you can always file a complaint with the board. We have had complaints that have been filed with a name, and we've also had anonymous complaints filed. If we have sufficient information, we are investigating those complaints, especially if you believe there is a patient safety hazard. Our inspectors and investigators today and recently have been out and in the pharmacies asking questions and gathering information. So that allows the board to do our regulatory job to protect patients. So we would encourage you to do that again. If you have a way to submit that anonymously, you can always do that. We've gotten a lot of anonymous complaints, and we are tracking and keeping all of them as they come in. How can you contribute to the board and the task force? All suggestions, you can always email us, missouribop@pr.mo.gov. As the task force begins to form and we will announce their meeting schedule, we will also announce ways that you can provide information or things for consideration to the task force. Actually had some conversation about this on today. So we will make sure you have information on ways that you can give ideas and suggestions to the task force. If you have any in advance that you'd like us to present to the task force and or the board as well, please send them to me, because we'll make sure that we're taking a look at them. But again, if you believe that there is a patient safety risk that you think that the board needs to be involved in, please file a complaint and or send us something, even if it is anonymously. Make sure that we know. We are getting complaints in that say, you know, the ABC Pharmacy in Springfield. That doesn't help me if we don't really know the name of ABC Pharmacy. If you can give us sufficient information and we find that it's something that falls under the board's regulatory authority, we will definitely and have been taking a look at that.
Many people have asked this, and I give the answer. Why don't we report our CE to the CPE monitor? Because we are not an ACPE provider, we have to go through a different process to do that, and we do not meet all the requirements in order to do that. So right now, we are not able to report to the CPE monitor. We have modified our audit process we look at the CE that we issue in addition to what's in the CPE monitor. So I've had people tell me I don't like doing your webinars because I always get audited because that has been corrected. We now, after we look at the CPE, doing the CE audit, after we do the look at CPE and who doesn't have 30 hours, we then look at who we issued CE to in that period, and we keep track of that. So people, you don't automatically get audited if you don't have AC from us. So we have improved that, but I do not envision us being able to report to the CPE monitor.
And I'll add this plug while Tom is looking at our last question, that we are doing a 100% audit now of all licensees using the CPE monitor and also our CE database. As a reminder, pharmacists in 2022, 30 hours of continuing education will be required to renew. We reduced that during COVID-19, but we are back to 30 hours. So please start counting hours early, because hopefully we won't have to contact you on a CE audit. I think we have time for one last question, Tom.
Someone's asking about how do you handle the dropping of a tablet or capsule on the floor? They have trouble explaining to technicians how that's not appropriate. It's an unsanitary condition. Board rules prohibit that. So I would stress to them that that's why you shouldn't be reusing things that have been on the floor. We have one other question on out-of-state C2 prescriptions. Can they have the full amount instead of a partial fill? I'm making the assumption you're asking about the opioid 7-day limit, and that only applies to prescriptions that are prescribed in Missouri. So it wouldn't apply if it was an out-of-state prescriber. So we're out of time here. I will go over a couple things. Our next webinar is next week. We have one, it's dedicated for technicians. Pharmacists can do it, that's fine. We do ask that pharmacists, owners, managers, please put the word out. There'll be more email alerts going out, I think one today or tomorrow about this. If you would please share that with your technicians to make sure they're aware of that. In September, we're going to have our annual compliance update with a question and answer session with a couple of other inspectors. And then Mo HealthNet Program Integrity Unit is coming in October to give us an update on their activities. As I said, we do record all our videos. It can take up to 15 days to get posted. Previous ones from this year was a COVID update, and back in March, I did a regulation update. For continuing education, you must complete the post survey that will pop up after I close the webinar. So do not close your browser. Once I say I'm closing the webinar, a screen will come up that says that I ended it. You hit close on that. Again, do not close your browser, and a survey should pop up, answers the questions, and click submit. If you do not get the questions, you can email us at compliance@pr.mo.gov, and we will email them to you. If we do that, you must get the answers back to us within 24 hours in order to receive credit. And again, we now email our certificates to you at the email you provided in the registration, and that can take up to 30 days. So again, on behalf of Kim and I, we want to thank you all for attending the webinar today. I am now going to close the webinar.